Ladies, hormone imbalance could be affecting depression and anxiety. I'm here with Keith Bishop today, our clinical nutritionist, and we want to talk to you about how we can help you feel better faster. Flourish Pharmacy specializes in compounding custom hormone replacement therapies. And today I'm with Keith, and we want to talk to you a little bit about how we can help partner with you to do that and look at some of those levels, as well as some natural options to help you combat your depression and anxiety. So Keith, what are some ways or how do you see some ties to hormones and depression and anxiety?
Well, I've actually seen it in my practice, and I've had women come in actually for depression, and literally we're looking at symptoms and boo-hooing. I mean, I've got Kleenex on my desk, and then, but we start talking a little bit more and looking at more symptoms, and we realize, wow, there's some hormone changes going on. Okay. And it could be, through a menstrual cycle or post-menopause, and a lot of times, those changes going on changes the receptors, in the nervous system, in the brain. And so depression can be very significant. And anxiety somewhat, and supplementing those hormones, if needed in those situations, can have a very dramatic effect. Okay.
So what hormones are involved when you see kind of that depression or anxiety setting in? What hormones do you see typically involved in that?
Typically, it's going to be more of the estrogen and progesterone. Those are the two main women's hormones as we think of it. But even both of them, it's kind of surprising. Estrogen being low or changing can contribute to depression and anxiety, but so can progesterone. Okay. And so they're both very important, and the balance of that. So if progesterone's low and estrogen's a little bit high, that's a problem. If estrogen's low, progesterone's normal, that's a problem. So we have to find out that balance.
Really looking at that balance. Mm-hmm. So how do you evaluate that then? It sounds like it's a pretty complex thing to look into. How do you balance that, and how do you evaluate it?
Well, there's two ways to look at testing for that, and one's going to be going through your healthcare practitioner. They'll do a blood draw. Typically, if you're a menstruating female, that needs to be day 19, 20, 21 of your menstrual cycle. At that time, estrogen and progesterone should be on the high side. Then post-menopause testing can be done at any time, but then we must also look at symptoms. Yeah. So hormone levels are different for everybody, and symptoms are different for everybody, and we have to match those up.
Okay. You've mentioned kind of hormones specifically, but also there's some neurotransmitters involved in this. Mm-hmm. So what's going on there, and how do you evaluate that as well?
So neurotransmitters, we've known there's prescription products, to help out with depression and anxiety, and then there's actually some supplements too that are precursors to the neurotransmitters. Yeah. We can not only test for hormones, but we can also test for brain chemicals or neurotransmitters. Okay. So if those are low, that creates a problem, or an imbalance that creates a problem. So the hormones actually attach to the brain cells and create imbalances if they're not working right, and the neurotransmitters attach to other receptors, and so we have to have a balance of both. And there's even some products that we have here at Flourish that do both neurotransmitter and hormone support.
Okay. So let's say we do go forward with either a prescription, customized hormone therapy, or something to help with neurotransmitter, or maybe a supplement. How long does it usually take to see a result in that?
We start typically seeing results within about 2 weeks. It kind of gradual. It's not typically instant. But then actually it takes about 2 months to see the total effect. Although the more body fat a person has, the longer it could take. Hormones are fat soluble. They'll go into those fat cells. So it can take up to 6 months to see the final result on any time you make a change, whether it be for hormones or neurotransmitters.
Okay. Well, here at Flourish, we specialize in customized hormone replacement therapy. And in fact, we were the first PHAB accredited pharmacy in Oklahoma, meaning basically we have more stringent guidelines, which means we care about that final quality product that you're getting. And we can work with your healthcare provider to get a prescription that's right for you. Or come see Keith today, talk to him about how you can get your levels checked and maybe some natural options as well. This is just another example of how Flourish helps you feel better faster.